Hello, everyone. I'm Nancy D. Miller. I'm the Executive Director and CEO of Visions Services for the Blind and Visually Impaired. We are a nonprofit vision rehabilitation agency providing services for people who are legally blind and multi-disabled and their families in the New York City metropolitan area. I am here with my colleague, Michael Cush, and I'll ask Michael to introduce himself.
Hello, everyone. My name is Michael Cush. I am the Senior Director of Workforce Development and Technology here at Visions. I oversee all programs related to workforce, job placement services, and pre-employment work readiness training for adults, which also includes technology training for people who are blind and visually impaired.
Thanks so much, Mike. And today we're going to be talking about some of the successful models that vision staff use to increase the employment of people who are blind and people who experience multiple disabilities. This is a critical issue since less than 45% of people who are blind who want to work are actually employed. So anything that we're able to do to increase the number of people who get employment that is commensurate with their education, skills, and background is a real plus for the blind community. I'm going to talk with Mike about some of the programs that we've been operating even during COVID-19 and the pandemic, and how we've been able to enable people who are legally blind and people with multiple disabilities to be in what is called competitive integrated employment settings, meaning that they're getting jobs in businesses, in nonprofits, in companies, just like a sighted person would. But we provide whatever accommodations and whatever pre-employment training and work readiness the individual needs in order to be successful in the job. We call this sector-based employment because we speak with the employer first to find out what their needs are, and then we train each of the individuals that we work with the skills that we know employers are looking for. So, Mike, why don't you tell us a little bit about the range of services that Visions provides for job seekers?
Sure. So most of our clients are referred to us through the Voc Rehab agencies, primarily the New York State Commission for the Blind, and we also get some clients from the New Jersey Commission for the Blind. And we're given these clients to work with, and most of them come to us with one thing in common, and that's they have legal blindness, 20 over 200 or less. And we do a very thorough assessment and evaluate what their skills are and what their goals are, based on their individual plan for employment. So when working with them, we decide, they decide rather, sometimes with our guidance and our assistance, what employment track they want to pursue. So for example, if somebody wants to work in a warehouse, we ask them why they chose that career trajectory, and how they feel they can be successful in that job. And we do a very, as I said, thorough evaluation / assessment on what their skills are, and also what things they may need to improve upon. If somebody wants to work in a warehouse, do they have good mobility skills? Are they comfortable navigating in an unfamiliar space? Do they take direction well? Do they have the ability to have a flexible schedule. And focusing on these things really helps them become successful, because we find or identify the services that they may need on the front end. So if they aren't comfortable navigating in a space, we can get them some orientation and mobility training. If we inform them that if they want to work in that type of setting, they may have to have flexible hours. So they may need to work out childcare, or if they're a student or have other obligations, they need to understand that their level of flexibility needs to be taken into consideration. But as I said, we get clients of all levels. If somebody is referred to us and they come to us for placement assistance and they want to do social work, they have their master's degree, maybe they have their license, but how good are their computer skills? Do they have a good methodology for taking case notes? Are they comfortable using assistive technology to do research? So being able to evaluate all of these things on the front end really gives us a better sense on how to best work with them and figure out their plan for employment moving forward.
And I know, Mike, that one of the reasons that Visions is successful, as you said, we work with people with different skill levels, different backgrounds, different education, different licenses. But how do you actually make the match with an employer that might be looking for a candidate with that background, but may be uncomfortable hiring a person who's blind?
We've taken several different approaches to that, and it's a really good question, and I think it's something that we've really kind of made our mission within a mission to make sure that employers are comfortable. And by doing that, we have them come to our site, or we host employer awareness events where they speak to other employers and network with other employers who've been successful in hiring our clients, and can speak to the accessibility needs for somebody who's blind or has low vision, and how they've worked within the past, and also talk about how successful they've been and how their employee was a great employee or is a great employee. So that's just a few of the things we do. We also have them meet with our blind and visually impaired staff, including myself. We can answer directly any questions in a non-threatening, non-judgmental. We always say, you say what you need to say. Don't worry about offending anybody. We can kiss and make up later. We want you to be comfortable working with somebody who's blind or visually impaired, and if that's something that we need to work together on to make you feel more comfortable, we'll do whatever it takes.
Now, we know that of the job seekers that we work with at any given time, anywhere between 25% and 50% are people that have other conditions or disabilities that could potentially interfere with their ability to work, whether it's an intellectual or developmental disability, somebody who may be on the autism spectrum, somebody who may have a physical disability or challenge. We work with people who are deaf and blind, people who have no other disabilities but don't speak English and only speak another language. So I can imagine that for an employer, these are other obstacles that they have to overcome in order to consider that person to be a good candidate for work. What exactly do you do at Visions that helps employers be more comfortable with candidates that are probably unknown to them, or certainly that they've had very little experience with?
Well, like I said before, we work with them closely, reassuring them that this is a ongoing process, and we're not just asking them to interview and hire our candidates. We assure them that we're with them for the first 90 days of employment at least, and beyond in most cases, because we want to maintain a good, strong relationship with that employer to refer other candidates. So to kind of help address their concerns, we let them know all the services that are available through Visions, that we provide in the workforce department and along with our other departments. So, like I said before, if somebody needs additional orientation and mobility, we're happy to provide it for as long as it takes for the person to be comfortable and for the employer to be comfortable with that person moving around in the workplace. If somebody has an additional disability or secondary disability, we can offer them job coaching services. And these are job coaches that we've trained ourselves in-house using a curriculum that was developed in conjunction with another organization that assists people with developmental disabilities, approved by the New York State Commission for the Blind. And the job coach will work with that person, helping them to, maybe solve some things that we might consider simple tasks, helping them to do things alternatively, helping them to stay calm, helping them to stay focused, using techniques and exercises, and if necessary, additional assistive devices to help that person accomplish the tasks of the position. And same thing goes for somebody if they don't speak English as their first language. We have interpreters at Visions in 16 different languages, including American Sign Language, where we can provide on-the-job support. It can be done in person or it can be done virtually. If it needs to be done in a pinch, using language line or using video conferencing, FaceTime, whatever technique works best for that person and the employer, and depending on the work site as well.
So, how has the pandemic, how has COVID-19 affected the job seeking and job placement services that Visions is providing?
It had an initial impact, especially for in-person services, in-person jobs. We did have some clients who were laid off from their positions due to the pandemic. Mostly people working in retail, hospitality, the obvious pain point positions where people were getting laid off. But what we were able to quickly do was transition to virtual online job placement training and job placement services. We were able to do a number of different work readiness or soft skill training over Zoom. Our technology team was great at bringing our clients up to speed on being able to access the virtual platform on their smartphone, or if they had a computer or a tablet at home, we were able to walk them through it over the phone if necessary to get them up and running. And for those clients who may have not had any type of assistive technology or smart devices or a computer, they were able to call into the conference, so they could at the very least get something out of it, just being able to listen into the sessions. As far as finding people jobs, as you can imagine, like everyone else, it was a bit more challenging. Employers weren't seeing people in person. Employers were uncertain how long this pandemic was going to last, and now we're looking at almost 2 years. So they were kind of uncertain about their hiring practices. But the areas where we looked to, where we had strong connections were healthcare and retail warehouse. Places like Amazon, whose business was booming in the pandemic because people weren't going into supermarkets or electronic stores. I mean, a lot of them weren't even open in the very beginning. So capitalizing on our relationship with those types of employers provided a client was comfortable venturing out into the community. We were able to place a number of people in those types of jobs. As far as healthcare, places were hiring a number of positions virtually, administrative assistant, then contact tracers. So, we had good relationships with a number of healthcare providers, and we were able to get clients in to those types of jobs. The other really positive thing that came out of the pandemic is, since we were finding many virtual jobs, we were getting individuals placed in jobs who would have normally had a challenge based on where they live. Some people live in very rural areas with very limited or no access to transportation. So all they could do was a work from home job. And since they were becoming more plentiful, we were able to place a number of people that normally, one, we would have never even seen as a client because of their geographical location, or they wouldn't have been able to take part in any of our virtual services, such as work readiness training, because they were all center-based prior to the pandemic. Now we're able to not only take part in job readiness training, virtual interview practice, so on and so forth. They were actually placed in jobs working virtually from home.
And I know the national statistics have shown that people with disabilities actually have increased the percentage of people who are employed, not by a huge number, but because of the circumstances that you were just describing, many employers are finding it hard to find good candidates, and they're willing to take a chance on populations that maybe in the past they might have been more reluctant to consider. What have the numbers been like for Visions in terms of people who are placed at jobs, and all of the jobs pay at least minimum wage, and many come with benefits as well? What's your experience been?
It's been quite positive, actually. When the pandemic initially set in, we were kind of nervous as to what it was going to look like in terms of hiring. I mean, people were getting laid off in droves. Unemployment went to double digits literally in a couple of weeks. So again, looking at the needs that were still there, and looking at our client pool, our candidates, we got lucky in some senses, and then just resourceful in others in terms of being able to place people. I mean, we had in 2021, we'd placed more people in jobs than any year prior, by a decent amount. So it was good that we were able to pivot to virtual training, virtual placement services, virtual meetings, virtual social work groups, and just being able to work with the client, preparing their resume, getting their cover letters together, preparing them for virtual interviews, because that's where most people were getting, or how most people were getting their interviews, whether the job was in person or not. So we found great success in moving to providing virtual services.
And I know from talking with you and the members of the workforce department that the range of jobs that we've helped people get really are everything from, entry level warehouse positions to we recently placed somebody as a software engineer.
Mhm.
Can you talk a little bit about the kinds of jobs that blind people are doing and that we've helped them to actually land?
Sure. So as I said earlier, we placed a lot of people in warehouse type positions, some with the assistance of a job coach, others with not. Many of those are full-time roles with benefits. Sometimes the starting salary is as much as $22 an hour if they're working overnights with the nighttime differential. Many of these positions pay overtime and offer overtime, especially around the holidays. We did place a gentleman as a software engineer making well over six figures. We placed somebody as a social worker. We've placed several people, as I said, as contact tracers. We've also placed people in healthcare, providing healthcare support, working in food service. I think the average salary for Vision's clients last year was around $22 an hour to start. So definitely well above minimum wage. And as you said, many of them come with benefits, healthcare, time off.
That's great. That's terrific.
Mm-hmm.
And I know one of the gems of Vision's programs is our Vocational Rehabilitation Center. This is a brand new building and a program that started in 2017. And the goal was to help blind youth, legally blind youth, between the ages of 18 up to their 22nd birthday, who were disconnected from either work or education. They had graduated from high school, but they were not in college or vocational training. They were basically at home, in many cases doing nothing, in some cases leisure activities, but really with very little future. And we reached out to the New York State Commission for the Blind to fund this project. And it really was a pilot project to see if we can help this age group move from not having a future to a future that was really what they wanted to do. Could you talk a little bit about the program, the Vocational Rehab Center, the kinds of jobs that people were training for, and what the results have been?
Sure. So yeah, we started this program in 2017. We've had varying sizes of cohorts. The range has been from a few to over a dozen. And what's really worked well for this program is the students living on site, working together, taking courses, sharing ideas with each other, and obtaining certifications that they then can go on to use in jobs. We've had a number of people study to be teaching assistants, taking the licensing exam for New York State, and have gone on to work in schools. We've had a couple people who now work for the Department of Education in New York City as teaching assistants. We've had a couple of young individuals study to be HVAC technicians. They've gone through the training, they passed the course, and are both, well, one of them was employed, one is soon to be employed, and they really learn a lot in what most people would consider a non-traditional employment track for people who are blind or visually impaired. when you think of jobs for people who are visually impaired and blind, HVAC technician doesn't pop out at you as one that individuals would be looking to do or capable of doing. And so, working with our trained staff at the VRC and ensuring that accommodations are in place and that the training materials are accessible and that the work site can be accommodating. It worked. They got through it. So, I mean, those are just a couple of examples. We had other people study to be veterinary technician assistants. A couple of people took the web designer, web development courses early on. So many different courses that people are able to take over a 15-week period. And with the support from our staff, they've all done very well.
So I know we have about a 60% success rate for people who have graduated from the Vocational Rehabilitation Center, meaning that after they graduate, they're either working or they have actually applied to go to college or a specific vocational training course.
Mm-hmm.
Can you talk a little bit about the demographics of those students? Are they all just blind? Do they have other disabilities? And how is that accommodated in a 15-week residential program?
So, yeah, many of them, well, all of them are visually impaired, but many come to us who have other challenges, other difficulties, other disabilities. Some were on the autism spectrum. Some have mental illness. Others, have difficult, very challenging home lives. And others were just very sheltered and isolated. The day they came to the VRC might have been their first night away from home. They might not know how to make a bed or make a sandwich, for that matter. So they bring a bunch of other challenges to our program, but because it's a residential program and because we have licensed social workers on staff and certified vision rehab therapists, certified O&M instructors, we're able to address some of these challenges alongside getting them a certification and teaching them workplace and work readiness skills. The social worker can do small groups for individuals who may have come from homes where things aren't so great, or one-to-one counseling for people who have mental illness or PTSD that have come to our programs. And again, learning the independent skills to be able to know that you have to wake up on time and how to make sure you set an alarm or 2 alarms or 3 alarms if need be, and be able to prepare your lunch for work because, if you're starting out in an entry-level position, you might not be able to afford a $12 or $15 lunch every day. So getting all those skills while obtaining a certification is just as valuable, if not more, for long-term success.
Now, I know it's a great program, and we're hopeful that when the Omicron variant recedes a bit, that we'll have more students who are willing to come to a residential program. Another success story that we had and continue to have is with blind students who are in college or graduate school. And we were approached by the Lavelle Fund for the Blind to work with these students who are receiving a scholarship through the foundation. Prior to Vision's involvement, many of the students graduated but didn't get work that was commensurate with what their degree was. And we've now been working on this program for a number of years. Can you talk a little bit about what those successes have been with our career counseling and guidance for blind college and graduate students.
Yeah, definitely. So we started this program a little over, this will be our 6th year. And we've definitely seen a marked increase in individuals graduating and getting more jobs commensurate with their degree. If somebody's coming out with a degree in social work or a degree in counseling, taking a minimum wage job is not really a good return on your investment. So I think the key to the success there was identifying the challenges they might have in school and addressing them, working closely with our career services program manager, along with the rest of the workforce staff, in trying to intervene early on by making sure that the person is comfortable and able to advocate for themselves, for the accommodations they need, and to utilize all the tools at their disposal that maybe they're not even aware of. The Office for Students with Disabilities, the Career Management Center at their college, and understanding how and when to approach those individuals for assistance and guidance. And then also, one big thing we found is that they weren't communicating with their state rehab counselor very frequently. So, the counselor, to them, no news is good news. But by the time they find out that there might be something not going well, it may be too late or difficult to rectify it. So encouraging open communication and more frequent communication with all the people that can be assisted or can be assisting that student, I think was very helpful. But the biggest thing was finding meaningful summer internships, working at a job over the summer in an area that they feel like they want to study, or they are studying, they want to become employed in someday. And sometimes the outcome is, I tried this over the summer, I don't really like working with children, so I think I'm gonna change my my major to something else. Or I wanted to be a cybersecurity expert, but I took an internship and I found out I really didn't have the patience to do all the little minor things you have to do to be successful in that type of role. So those were some of the outcomes which ended up being positive, because the person was able to switch their career path, move in a different direction. But also those who found internships with the assistance of Visions, and were able to get really good on the job, real life work experience, not only gave them the skills, but it gave them the confidence that, yes, I can work in a setting where I'm given a deadline that might be tomorrow, and I can rise to the challenge. Or if I didn't know how to do it before, I've gotten the tools working with Visions on how to do it now. Because one of the biggest challenges we found with students that came out of college was time management. And most of the time it's because they have free time in their hands and they're given most of their assignments at the very beginning of the semester. So procrastination is easy to set in. That, of course, doesn't happen in the world of work. So that's something that we teach in our college work readiness training, and that they learn during their summer internships.
I think procrastination and time management is something we all have difficulty with, whether we're blind or sighted.
Sure.
But I know that it's an area that Sometimes blind students are given a pass, or the expectations are not as high, and so they don't learn, they don't experience it, and they don't learn what's going to be really required in the workplace. And being able to give students real life experience in paid internships is a real plus, not only for the time management, but also getting a paycheck, learning, what's FICA, what
Yep.
gets taken
Yep.
out, what are taxes,
Hmm.
how to budget. I know those are areas that we also work on with the students. Well, it's clear why Visions is number one for the sixth year in a row for job placements of New Yorkers. Can you just speak for a minute about the work we're doing in New Jersey, and how did we expand into the New Jersey area?
Yes. So a number of our staff live in New Jersey, and we've looked at what the needs are, and we hear about what the gaps are for service in New Jersey. That their Voc rehab services for blind individuals is somewhat different, as to they provide services through their Voc rehab agency, all of which are done in-house. And the ones that they contract out are not with blindness agencies. For example, if somebody in New Jersey needs a job coach, they contract with an agency that provides job coaches, but their primary focus is working on people with developmental disabilities. They have little to no experience working with people who are blind. And there's just been lots of gaps in terms of providing people adequate job placement services. Individuals can't get to the jobs that are available, or they're not getting properly trained for the types of jobs they want, whether it be in technology or soft skills training, independence training, anything that's going to make them more ready for work. So with an assistance from one of our funders, we expanded our scope for providing services in workforce to New Jersey clients. Now, we started small. We just looked at a few different counties, and we approached the Commission for the Blind in New Jersey. And at first, they were somewhat reluctant. They were thinking, why do we need an agency when we can take care of this ourselves? But I think when we talked to them about how we prepare our New York City job seekers, and also the contacts that we have in New Jersey, they were a bit more open and willing to work with us. So we've found a few people jobs. I think we've placed 6 people in total. I think had it not been for the pandemic, that number would have been much higher. But many of them in warehouse type positions, again, through our contacts. Also, the New York, New Jersey Port Authority, we placed somebody there. So, we hope to continue to expand and serve even more people in New Jersey. But I think so far, we've gotten off to a good start.
And we have only a few minutes left, but can you describe a job seeker who was placed in a job that was one that even surprised you? And you have a lot of experience in workforce development, but is there one particular job, either because of the particular employer or because of the nature of the job, or the particular candidate, that just kind of stands out for you as something that you and your department are really proud of?
Yeah, I mean, there are a few of them. We did had one person who brought many other barriers, where to the point where vision loss was probably the least of their challenges. They had PTSD, manic depression, homelessness, just really a tough break. Certain times aggressive, intermittent explosive disorder. But the one thing that always held true is the person wanted to work. They wanted a job. They had been hired and let go of a number of different jobs before they came to us, mostly because of behavioral issues, not performance. But we work with them, and I think the biggest thing was, we took many members of the team work with this person. Also, our social worker, our mental health counselor, and then once they were placed, a job coach. And we asked them to kind of take a step back and say, yes, we're definitely going to place you in a job. We know you want to work. We know you can work. We just want to get some other things in place, like steady counseling, a place for you to live. And I think once those things were in place, we did find the person a job that they weren't happy with at first. I think they just didn't like the people around them. We had the job coach work with them. They continued receiving social work services from us, and then we also got them a regular permanent therapist. And our director of placement services worked very close with this person, kind of had like a real soft spot for them, and knew how to kind of put them at ease, make them feel like we're really working on their behalf, because I think that's the biggest challenges that this person was facing before. And yeah, it worked out. The person had been working for over 4 years,
Wow.
making a good salary, received increases, had benefits, working full time, now has a permanent place to live, their own apartment. And so yeah, that's one of a number that I can mention, but that one kind of stands out the most because that was like truly a team approach.
Well, thank you so much, Mike, for your time and talking about what we think the ingredients are for successful job placements. Anybody can reach us at Visions. Our email addresses are our first name initial or last name at visionsvcb.org. That's N for Nancy, MILLER, at VISIONS, that's VictorCatBoy.org. And Mike Cush is M for Mike, CUSH, at visionsvcb.org. But if you forget our names, info at visionsvcb.org will also get to us. Thank you so much for joining us, and we look forward to hearing from you.
Thank you,
Have a
everyone.
great day. Thank you, Mike.
Thank you.